As men get older, they become much more likely to face difficulties related to sexual health, especially erectile dysfunction. Throughout my experience in the field of urology, I have seen that this is not an isolated case or a topic limited to a few. It is a deeply human medical reality that affects millions of men in silence. Statistics support this situation. An epidemiological study conducted in the United States in 2010 revealed that 1 out of every 5 men between the ages of 25 and 70 has some degree of erectile dysfunction, and this percentage increases significantly with age. Among men aged 50 to 59, nearly 1 in 4, about 25%, already experience difficulties maintaining a satisfactory erection. When we look at men between 60 and 70, the number rises to 42%, nearly half. It is estimated that between 1 and 2 million men in the United States face this problem, and if we look at it globally, the number is even more alarming. According to the World Health Organization, by 2025 there will be more than 300 million men around the world affected by erectile dysfunction, 152 million more than just 3 decades ago. But behind these cold numbers lies something far more sensitive: the emotional, psychological, and relational impact that this condition causes. Erectile dysfunction is not only a physical issue. It is a wound to self-esteem, a silent threat that weakens confidence, generating anxiety, frustration, and, in many cases, shame. It affects relationships, lowers quality of life, and often leads to emotional isolation that men rarely express. We live in a society that has imposed a silent but intense pressure on men, sexual performance as a symbol of masculinity and a measure of personal worth. That is why, when erections begin to fail, many men do not talk about it, do not seek help, and close themselves off. Worse still, some turn to quick fixes or supposed miracle treatments without medical backing, which can make the situation worse. Over the years, I have heard the same sentences from my patients: "I'm not the same anymore," or "I don't understand what's happening, I never had this problem before." However, I have also seen how many of them manage to transform their situation once they receive the right information, practical tools, and proper professional guidance. It is true that time brings changes, but aging does not mean giving up or resigning oneself to losing one's sexual life. Many times, mild or moderate erectile dysfunction can be reversed or significantly improved without medication. The problem is that most men do not truly understand how their bodies work in this area or how they can strengthen their sexual health actively and naturally. Today, I want to tell you about a solution I have seen work for hundreds of men in consultations. It is a protocol of 3 specific exercises designed not for the gym or to burn calories, but to strengthen the muscles that support erection, improve blood flow to the penis, and increase sexual stamina. They do not require expensive equipment or large spaces. They can be done at home, quietly and privately. They are based on a deep understanding of male physiology and address the problem at its root. They are not empty promises or temporary trends. They're a real tool to regain control. And if you stay with me, I will explain not only how to do them, but why they work. Because sexual health is not just about pleasure. It is about well-being, confidence, vitality, and above all, quality of life. Many men ignore something fundamental, and many doctors fail to explain it clearly. Erection does not depend only on desire or emotional state. No, it also depends, in a crucial way, on specific muscles, on optimal blood flow, and on proper physical endurance. And all of that, like any other system in the body, can be trained. It can improve. It can become stronger. Over the years, I have observed that the pelvic floor muscles, which are essential for maintaining a firm and stable erection, weaken over time. Sometimes it happens due to age, sometimes due to chronic stress, and often simply because of lack of exercise. It is like any other muscle group. If it is not activated, it atrophies. Now, what really happens during an erection? Let's understand it from its physiological base. When sexual stimulation occurs, the brain and the nervous system send signals that relax the arteries carrying blood to the penis. These arteries expand, allowing large amounts of blood to fill the corpora cavernosa, 2 spongy structures inside the penis. These chambers fill with blood, and the penis enlarges and hardens. But here comes a key part. At the same time, the veins that would normally let blood flow out of the penis are compressed. It is that balance between the inflow and retention of blood that generates a firm erection, and the silent protagonists of this process are two pelvic floor muscles, the bulbospongiosus and the ischiocavernosus. The first helps push blood into the penis and maintain rigidity. The second compresses the veins to prevent the blood from escaping too soon. But if these muscles are weak, whether from inactivity, aging, or lack of use, they cannot perform their function properly. If the muscles and blood flow do not work correctly, the blood is not retained and the erection is lost. Believe me, I have seen this hundreds of times in consultation. But there is more. It is not all about the muscle. The endothelium, the inner layer that lines the blood vessels, also plays a fundamental role. When this tissue is healthy, it produces nitric oxide, a powerful vasodilator that allows the arteries to expand and blood to flow freely into the penis. What can damage this system? The usual suspects: high blood pressure, elevated cholesterol, diabetes, and smoking. All of these factors silently damage that inner layer. And when the endothelium does not work well, neither does the erection. But there is good news. Just like any other muscle in the body, the pelvic floor muscles can be trained. And not only that, by exercising them, circulation also improves, nitric oxide production is stimulated, and the physiological response to sexual arousal is enhanced. In other words, you're addressing the heart of the problem, resolving the root cause rather than just the symptoms. I don't say this only from clinical experience. There are serious studies that support it. One published in the British Journal of General Practice followed 55 men with erectile dysfunction for 6 months. The participants were divided into 2 groups. One received only general lifestyle advice, while the other followed a structured pelvic floor exercise program. The result? 40% of the group that trained fully recovered their erectile function, and another 30% experienced significant improvement. In other words, 70% of the men achieved a tangible and measurable change, all without medication, only with specific training. This study clearly shows that this is not about theories or empty promises. We are talking about real results. While one group was limited to general recommendations such as improving diet or doing regular exercise, the other worked directly on the muscles responsible for erection. The difference was enormous. That 40% total recovery rate is not a minor detail. And if we add the additional 30% who improved, the outlook completely changes for any man who has lost hope. And this is not the only study. Researchers at the University of West England demonstrated that pelvic floor exercises can be as effective as certain medications for mild or moderate cases of erectile dysfunction. This is crucial because not all men can or want to take drugs. Some have medical contraindications, while others simply prefer a more natural approach without side effects. The best part is that the benefits are not limited to erection alone. These exercises also improve orgasm intensity, ejaculation control, and overall sexual satisfaction. Many men who have followed these practices have told me that after several weeks of consistency, they not only regained firmness, but also found their orgasms to be more intense and complete. Others noticed they could last longer during intercourse, something that once seemed impossible. These are details that completely transform one's intimate life for them and for their partners. Regaining control over your body also means regaining security and confidence. This is reflected in how you talk, how you move, and how you connect with others. That is why I insist so much on this approach. It is not just about sex. It is about reconnecting with a fundamental part of yourself. And the best part, you can achieve it on your own. No pills. No invasive procedures. Just you, your commitment, and a plan that truly works. Consistency is more important than intensity. I always emphasize this to the men I guide. It is better to dedicate 10 minutes daily for a month to these exercises than to do a marathon session of 2 hours once a week. The pelvic floor muscles, like any other muscle, need frequent stimulation to grow, adapt, and stay strong. It is not about doing a lot at once, but about sending the right message to your body every day. Just as you brush your teeth, shower, or get dressed every morning, these exercises should become part of your daily intimate self-care routine. The first exercise I recommend is what I call the advanced kegel for erection. I'm not referring to the light kegel that circulates on the internet, but a version designed specifically to strengthen the bulbospongiosus muscle, which is responsible for keeping blood inside the penis during erection. If that muscle is weak, it's like trying to inflate a balloon with a hole in it. No matter how much effort you make, the pressure doesn't hold. The key is to identify the correct muscle. To locate it, place 2 fingers just behind the testicles in the perineal area. Contract as if you were trying to stop the flow of urine or prevent passing gas. If done correctly, you should feel a light contraction just beneath your fingers. That is the pelvic floor. It is crucial not to tighten the glutes, abdomen, or thighs, only that deep internal muscle. If you are still unsure, a simple test is to try to stop the stream of urine midway, although I don't recommend doing it frequently, only as an occasional check. Once you have identified the muscle, begin the exercise. Contract firmly for 5 seconds. Imagine that you are trying to pull the testicles upward toward the abdomen, as if drawing that area inward. And here comes the advanced part. During the last 2 seconds of the contraction, squeeze even more, as if you were pushing blood toward the penis, aiming for maximum firmness from the center of the body. Then relax completely for 5 seconds. This step is as crucial as the contraction. Release everything: abdomen, face, shoulders. Give the muscle the time it needs to recover. Repeat this 15 times per set. Do 3 sets with 1 minute of rest between each. During that minute, breathe deeply, relax your body, and prepare for the next round. The progression plan is very clear. In week 1, maintain 15 repetitions and 3 sets. In week 2, increase to 20 repetitions, keeping the 3 sets. In week 3, go up to 25 repetitions and 4 sets. By week 4, the goal is 30 repetitions and 4 sets. This not only strengthens, but also builds endurance. A key tip: do not hold your breath during the exercises. Breathe naturally and calmly, keeping your face relaxed. You can do this exercise practically anywhere, while working, watching television, or sitting down. No one will notice, but you will feel the difference. The second exercise I teach is called pelvic flow intervals. Its purpose is to activate circulation in the pelvic area and improve the endothelial function of blood vessels, which is essential for achieving firm erections. This is not about generic cardio or running for 40 minutes. It is a short, focused, and highly effective protocol. Start with a brisk walk or marching in place for 3 minutes, enough to raise your heart rate, but not to the point of running out of breath. Then, perform 30 seconds of intense activity. You can choose between jumping in place, jumping jacks, modified burpees without jumps or push-ups, or quick squats. The important thing is to activate the entire lower body. The goal is to send a large amount of blood toward the active muscles. After those 30 seconds of intensity, move into 90 seconds of active recovery. Walk slowly, breathe deeply, inhale through your nose, exhale through your mouth, release tension, and then return to the cycle. Complete 4 rounds of this sequence, totaling about 12 minutes, 3 for warm-up, 8 for intervals, and 1 for final recovery. What are we aiming for? A phenomenon in medicine known as the rebound effect. During the intense phase, blood is directed to the active muscles. When you lower the intensity, the flow returns with greater pressure to areas that were previously less active, such as the pelvic region. This rebound is an excellent opportunity to train blood vessels, making them more flexible, reactive, and efficient. In the long term, this approach improves the quality of erections by strengthening vascular health in the area that truly matters. Perform this protocol 4 times a week, preferably in the morning when testosterone levels are naturally higher. Take advantage of that physiological moment to maximize the benefits of the exercise. If you cannot do it in the morning, that's fine, but consistency is key. The third exercise, perhaps the most complete, focuses on pelvic floor endurance, because it is not only about achieving an erection, but maintaining it throughout the sexual encounter. For that, those muscles need sustained strength and endurance capacity. Start by lying on your back, knees bent, and feet flat on the floor at shoulder width. First, lift one leg while maintaining the pelvic floor contraction. Raise it slowly, hold for 5 seconds, and lower it gradually. Switch legs. Do 10 repetitions on each side, keeping your pelvis stable without rocking. The effort should come from the center, not the hips. Next, perform hip bridges. From the same position, contract the pelvic floor and lift your pelvis until you form a straight line between your knees and shoulders. Hold for 3 seconds and lower slowly. Do 15 repetitions. Focus on feeling the strength from the pelvic floor and glutes, not the lower back. Finally, practice diaphragmatic breathing. Lying down, place one hand on your chest and the other on your abdomen. Slightly contract the pelvic floor and maintain the activation while breathing. Inhale for 4 seconds, hold for 2, exhale for 6. Feel your abdomen expand and contract. Continue this breathing for a full minute. Do not underestimate this exercise. It teaches your body to connect breathing with deep musculature, reduces stress, improves control, and strengthens body awareness. With these 3 exercises, done with technique and discipline, I have seen remarkable changes in men of all ages. But remember, it is not about doing a lot in one day, but about doing a little every day. Consistency is the true muscle that transforms everything. Now I want to talk to you about something crucial, the path. Because knowing which exercises to do is one thing, but performing them correctly, progressively, and safely is something else entirely. I have found that the problem is not only lack of information, but also lack of structure. That is why I designed a 4-week protocol that allows you to strengthen sexual function in a realistic and sustainable way. In the first week, the goal is not intensity, but awareness. This phase is about getting to know your body well, identifying the correct muscles, and mastering the technique without rushing. It is vital not to try to increase repetitions or the duration of contractions too soon. The goal is not to move fast, but to move correctly. During this first week, I recommend doing each of the 3 exercises 3 times, leaving at least 1 day of rest between sessions. For example, you could train on Monday, Wednesday, and Friday. A key point: pay attention to your sensations. Notice which muscles activate and how your body responds. That mind-body connection is essential for real results. In the second week, if you have already mastered the technique, it is time to progress. The first step is to increase repetitions in the first exercise, the advanced kegel. If you started with 15, now go up to 20, a 25% increase. Also, add 1 more session during the week, training 4 times Monday, Wednesday, Friday, and Sunday, for example. Many men begin to notice that their pelvic floor muscles feel firmer and more responsive. It's a subtle but noticeable change. The third week is designed to build endurance. Here we increase the contraction duration in exercise 1, no longer 5 seconds, but 7. It may seem like a small change, but it makes a big difference. Keep 4 sessions per week. It is common at this stage for men to report that morning erections are returning and stronger than before. This indicates that the muscles are responding. You might also notice greater control during arousal, even if there are no drastic changes yet during sexual activity with your partner. All of this is normal and shows that you are on the right path. The 4th week integrates the entire program. The exercises are no longer done separately. They are combined in a single session lasting about 20 minutes. It is time to increase the frequency to 5 sessions per week. By this stage, you are physically and mentally ready to sustain the effort, and the benefits intensify. In this phase, many men report significant improvements during sexual activity, greater firmness, longer duration, and more confidence. This is when all the work you have done begins to show real results. Now, an essential point: frequency and recovery. Start with 3 sessions per week to allow the muscles to adapt without overloading them. After 2 weeks, increase to 4. When you complete the first month, 5 sessions a week is ideal. But, and this is crucial, never train all 7 days. Muscles need rest in order to grow stronger and respond properly. If you push them too hard without giving time for recovery, you won't just reduce effectiveness, you'll also risk fatigue and frustration. At least 2 days a week should be full rest days or light activity days. It's also important to talk about the best time of day to train. Morning is ideal. Your testosterone levels are higher, which enhances the hormonal and circulatory response to exercise. Plus, training early helps you set a consistent routine, a key factor for discipline. If you can't do it in the morning, that's fine. The important thing is to find a schedule you can stick to consistently. However, avoid training right before bed. These exercises can activate your nervous system and make it harder to fall asleep. I recommend keeping a weekly record. It doesn't need to be complicated, just 3 simple indicators on a scale from 1 to 10. First, erection firmness. How hard does your erection feel? Second, duration. How long can you maintain it without losing rigidity? And third, your level of sexual confidence. By tracking these numbers each week, you'll see your progress. Believe me, nothing is more motivating than realizing your effort is producing results. In terms of physical changes, most men notice improvements in firmness within the first 2 weeks. At first, it might not be evident during sexual activity, but you'll notice it in spontaneous situations, like upon waking. Morning erections become more frequent, firmer, and easier to control. These signals are valuable. They show that the pelvic muscles are getting stronger. After the 3rd or 4th week, changes usually become noticeable during sex as well. That's when many men tell me, I feel like my old self again. They notice more stamina, better control, and greater ability to maintain erections. Not everyone progresses at the same pace, but this pattern repeats over and over. However, it's also important to know when to seek help. If after 6 weeks of consistent effort and proper technique you don't see improvement, it's time to consult a specialist. There may be underlying causes such as hormonal imbalances, vascular or neurological issues, or even deeper psychological factors. These exercises are very effective, but they're not a magical fix, nor do they work for everyone. And as I always say, asking for help isn't giving up. It's having the courage to take care of your health as you deserve. If you've made it this far, it means you're looking for more than information. You're looking for a real, honest, and achievable solution to an essential part of your life. I want to tell you that, as someone dedicated to men's health, I'm truly glad you're taking this step. Talking about these topics is already an act of courage, and choosing to act is even braver. My goal from the start has been to give you concrete, practical tools that you can apply right now, in the privacy of your home, without fear or barriers. I sincerely hope that the information and exercises I've shared today have shown you that there's a natural, accessible, and scientifically supported way to improve your sexual function. What I've seen in thousands of men aligns perfectly with what research confirms. These 3 exercises can bring real change, but like everything in medicine, they require 3 essential things: commitment, consistency, and realistic expectations. This is not an instant fix or a miracle solution. It's a strengthening program that builds lasting results. And those results aren't just felt in intimacy, but also in how you see yourself in the mirror, how confidently you speak, and how you face the world. Now, let me ask you something honest. Don't you think society has become too obsessed with quick fixes, shortcuts, and instant results? We forget the power of natural, sustainable methods, the ones that respect the body's own timing. I see it every day, men frustrated, tired of so-called miracle cures, who finally experience real transformation only when they slow down and listen to their bodies. That's when they find the change they were truly looking for. Another reflection. Don't you think that if we spoke more openly about sexual health, without shame or taboos, many men could overcome barriers that keep them isolated in silence? I believe that completely. That's why I'm here, and that's why I invite you to be part of this conversation. If this video was helpful, if you felt these words spoke directly to you, I encourage you to like it so that this information can reach more men like you. Subscribe if you want to keep learning through real, science-based content focused on men's well-being. And most importantly, tell me in the comments if you're going to try these exercises or if there's a question you'd like us to address together. We're building a community where we share knowledge, support one another, and walk this path toward full sexual health and greater confidence. See you in the next video.